want to use, I didn't want to use his name, but I would
Right.
use his name under that normal
Right.
circumstance. Yeah.
I do walk with me.
Danny. Walk with me. Nope. Danny. Now you did that to yourself, Dingbat. Danny. Danny, come here. Danny, look what I got. Hey, up. Here. Danny, come front. Danny. Look, come front. He spooked him and I caught his leash caught on my leg and it spooked him.
Yep.
Danny.
That's when he stays away from me too.
He's backing down.
Yeah.
You know what?
Yeah.
No, I don't care. Guess I can put these back. Nope. Leave it. Leave it. Leave it. Leave it. You're not getting it. Down. Sit. Sit. Slow the brain down. Slow down. Just slow down. That's all. Slow down, little boy. I know that tail's wagging. Sit. Danny. Danny. Slow the brain down. Turn the brain off. Sit. Thank you.
He's like an ADHD child.
He really is. Danny, sit.
So our great nephew
Sit.
is, and they live 5 houses away from us, and he's now 20. And when he gets near Danny, he says he acts like I did when I was a kid.
Well, he does have, he has some issues that are never going to be fixed.
Right.
And that comes a lot from, that's why I asked you how long the oxygen was deprived.
Yeah.
Anything over 12 seconds starts doing damage.
Oh yeah. Oh, yeah. It was
And
over there.
he's, you know, it's been a long time. He went a lot longer than he should have. I don't know, were they trying to blow into him? Do you know anything?
I can ask, but I don't know.
Yeah, see if they can tell it. See if they can give me a little more detail on when
Okay.
on how long he wasn't breathing,
Okay.
how much, because that can actually help me direct a few things more
Okay.
to where I'm going. I never thought why I didn't think of it sooner, but seeing the behaviors is what I needed to see, and I see the shaking, I see the nervousness. Now let's see if we can get him to wait.
Place.
He knows where he should be. He's looking at it, and he's watching me, which is
Place. Place. Danny, place.
the other problem we have here is we got a lot of distraction with noises that he doesn't know.
He's distracted with sound in general. I have that collar around him, but most of the time I can't touch him with it. If I touch his neck, he starts to growl and snap at me.
Okay.
So I use the slip lead.
It's because it's easier to get on and off.
Yeah. I had harnesses on him, but I can't touch his feet to get his harnesses on him.
Okay, so there's a harness, which I don't have my truck.
So
that goes around his side. You don't have to touch the feet. That you have to slide it over his head, which I don't know.
Yep, and that's an issue too, because when I put the I can't get the muzzle on. I have to put a treat inside it to get the muzzle. Everything is an ordeal and a lot of work.
And the gabapentin's not
Gabapentin is 200 milligrams of gabapentin and
3 times a day.
Yep. It's
So
600
milligrams, which should be more than ample to what he needs.
and then 50 milligrams 3 times a day of the trazodone.
Which is definitely more than he needs.
And so is it that should be a different medication?
Yeah, I would switch trazodone.
To what?
I'm gonna have to look it up.
So Jennifer Hammond,
What did she suggest?
the anatriptyline,
Yeah. Yep. You can try that.
and not do all of it, or not do the,
I would try leaving the gabapentin because I see some of this is neurological.
yeah,
So some of these issues are neurological. What might be happening with the neck and the touching on the sides when he's up in a certain position is his nerves might be
That's
firing and
sensory.
it's hurting.
that's a sensory like
Yeah.
an autism child does.
Yeah, so it might be something that's affecting him that way at an angle. So he might be affected that way. Without extensive neurological testing,
Right,
you don't know. And
Right.
even that's inconclusive, so I don't
Right.
suggest doing that. That's a waste of money.
where did I tell you to
have
go
a boy
place?
I have a boy with neurological issues. And I know if he's in a certain position, I can't touch him. Because he'll yell. He won't bite.
He yelps.
He yelps.
Yeah.
So what's happening is the same thing that's happening with Zion. Is when he's in a certain position, it hurts him. It's
Yes.
sore. So it's sensitive, or it
Yes.
tingles funny, or
Yeah.
it's some kind
Yeah.
of sensation.
There's
We
a
don't know what it
sensation.
is.
Right,
And so that's probably neurological damage from when he was born. When he was deprived oxygen. Because when
Right.
you're deprived oxygen for so long, it's 12 seconds. You literally have 12 seconds to start getting it
yeah,
smooth. And if they just was blowing in him, that's not enough.
right.
Because they need to circulate the blood too.
Right.
I don't know how far of a CPR they went with him.
The lady who was the nursery mama, she actually breeds dogs, French bulldogs. And so we moved the mama over on a Sunday, and they were born on a Tuesday. And 6 of them came within 45 minutes, and then he came 45 minutes later. And he was stillborn.
Okay.
So once he was out, she started working on him.
Yeah, I just need to know what she did, if she did the chest compressions,
Okay.
if she did just the blowing in the nose, because that's a lot of times what they just do is blow in
Yeah.
the nose to get the airflow,
Okay.
to get the lungs going. But if she didn't do the CPR, that means the blood wasn't flowing through,
Right.
which means damage was being done.
Right.
Unfortunately, that's what a lot of breeders do. They just do the,
Yeah.
breathing for him, trying to get him to breathe.
Right.
But we don't know how far he was gone because I don't know if he had a pulse, which I highly doubt she checked if he had a pulse.
Yeah, I don't know.
I don't know if he just had problems breathing. I mean, that's the
I
problem.
can ask lots of questions.
Yeah, I need a lot of detailed questions on, because that's going to dictate where we take him,
Right.
which approach I take. What I'm seeing personally is mostly neurological issues
Okay.
that are the problem. So the gabapentin I never want to lose,
Okay.
because gabapentin's almost like a good neurological
Yeah.
substance for him.
Yeah. Humans are on it too.
So yeah, I take gabapentin for seizures.
Yeah.
So gabapentin is like a really good drug. And the funny thing is you can actually go up in the dose of gabapentin and it won't hurt him.
So originally the vet said to give 300 milligrams each time, 3 times a day, 300 milligrams of gabapentin and 100 milligrams of trazodone. And I've been doing that slowly up to
I would jump him up in the morning
the 300
to the 300 and the higher dose of the trazodone in the morning.
at that first dose at 6 a.m.
Yeah.
Yes,
So
because
that's his
he's
first-
crazy in the morning.
Yeah, so that's where you want to get him in the first morning. You want to give him the higher doses.
And then do the
and
lower
then do
on
lower
2
doses
and
on
9.
the other 2.
Okay.
And just don't try to be really spot on with your time because trazodone is very time sensitive.
Okay.
Trazodone can be a time sensitive medication.
Okay.
And it could cause him to get a little wonky. And
Okay.
if you bring him off trazodone, decide to go with the other one, you got to wean him slow.
Okay.
I mean, super slow.
We did really slow with the Prozac too.
Yeah, Prozac. I am hit or miss on Prozac. I haven't found a lot of success rate on Prozac.
We've had some dogs in the rescue that have been really great with it, and then the rest of them have not been.
We'll see, like him, Simon.
Here, do you want this?
Any of them aren't dogs that are Prozac bound.
Right.
They're not Prozac dogs.
Can you go to place?
Simon, you know, I am impressed with Simon and how he's doing.
Yeah.
I mean, now all we got to do is convince her that that's her dog. I mean, I don't think she'd be able to give him up because I've met her. I know what she's like.
Sit down. I heard you. I don't care if you're talking to me. I want you to go to your place. Place. So how do I get him from thinking this is to that is?
Let's put it a little closer.
Okay.
Now get him in
Place. Place. Good
there he goes.
boy.
Good boy. There he goes. Once he did it, see you rewarded.
Yep.
That's perfect. Now get him to go to place. After
Place.
he gives you the ball.
Yep. Place. Place.
Nope, that ain't place. Right here. There you go. You touched it. Good job.
Go place.
He wants that ball. So
He does. Go place. Place.
You can pull it right.
Good
there you go.
boy.
See, he knows.
Good boy.
Now he's going to relate that place with you're going to throw the ball or he's going to get a treat.
Yep.
So we want to always
Place.
use an object.
Place.
If you go outside, this can be placed in the house.
Yes.
I don't care.
Place.
But you can also teach him to have a blanket outside for
Place.
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 You always want to show him
Place.
something down.
Place. Place.
Go sit.
Place.
And this is where his brain's going ahead of himself.
Yeah. He's always 3 steps away from what he thinks I need. Place. Place. Good boy. He's like, I'll just run over it. You'll throw it eventually.
And that's it. I mean, if he touches it, good place. Make sure you use this good place. Use the
Have it?
use the
sorry.
term.
Have it.
He was like, I'm placing it. See?
Place. Good place.
So you always want to tell him he's doing a good job with the place. Or a good job, no matter what the command is you're giving him.
I'm putting it in there.
He's like, I'll put it in place. The ball's going in place. You always
Have it?
want him to do whatever command you give him, you want to reinforce that with a good, whatever the command was.
Okay.
Good place.
I think
good
he's
sit,
done.
Good down.
Good boy. Good place.
He's like, this has been a long day.